Alright, so today we're going to be doing IV insertion for one of our senior skills. First thing you're going to do is you're going to assess the need for establishing an IV, whether you're going to provide some kind of medication therapy or whether you need to give an IV solution or anything of that nature. You're going to go ahead and gather up your supplies. Once you have all your supplies gathered up, you're going to go in your patient's room. You're going to verify your patient using 2 patient identifiers. And once you've done all of that, you're going to set up for the start of the IV. Here we have a nice little IV start pack. Alright. Somewhere there it is. Inside this start pack you have tape, tourniquet, cleaning solution, Tegaderm, and some gauze in case you mess up. Alright, you also have this nice little thrifty size and date sticker. Okay, I'm going to pull up my sleeves here so that they're not in the way. I'm going to have, whenever I come in the room, I'm going to have washed my hands and donned clean gloves because this is a clean technique. And at this time, I'm going to apply my tourniquet. Okay, once my tourniquet's applied, I'm going to assess for a proper IV site. Typically, you want to start at the lower end of the extremity that you're going to place your IV in. In case you do mess up, you can always move up from there. Alright? But this patient seems to have a good one pretty much anywhere. So, now that I have all of that in place, I'm going to go ahead and take my homemade flush here, because we couldn't find any in the school, and I'm going to attach it to this hub. Give that just a little push through, make sure there's nothing in there. Now that that's done, I'm going to look at my Tegaderm, make sure that's going to pull apart real easy because I don't want to look like a goober in front of the patient once I get started. Okay. For IV insertion here, what we have is a 22 gauge over the needle cath. You're going to want to make sure that's going to come off there good and easy, make sure the end of it's tore, nothing like that. Alright, now, before I would have done that, I would have cleaned my site, but I'm not going to open this. I'm going to clean at least 3 passes, but what you want to make sure is that this is actually good and clean, that you didn't need to clean your patient's skin beforehand. Alright, here we go. To insert this. And so normally when you pull this back, you're going to want to make sure that your needle is capped. For the sake of supplies, I'm not going to be doing that today. Alright, once that's in, I'm going to apply pressure. I'm going to connect to my flush. And before I flush, I'm going to pop my tourniquet, give it a little flush. I'm also not going to do that so that way I don't fill up this dummy's arm with fluid. Alright, and then once it's patent, once I know it's patent, I'm going to tape it down with the Tegaderm. And if you had a pigtail flush, you would also tape down and secure that.